financing testing and treatment. Throughout the pandemic, COVID-19 testing and treatment have been provided generally free of charge, or at a very low fee for some, practically for all residents. Given that COVID-19 was an unfamiliar disease, in DORSCON Green, we are establishing an endemic new norm and living with the disease. And this includes practically removing all border measures, all safe management measures, and managing COVID-19 routinely like common diseases. And hence, I seek everyone's understanding that we also need to transit to a new norm, or the old norm, of financing arrangements. And we cannot continue with the 100% subsidy that we have maintained. So the following changes will therefore be implemented. First, inpatient treatment in a hospital or COVID-19 treatment facilities will revert to the funding framework of S plus 3M. That is, S for government subsidy, 3M for Medisave, Medishield Life, and Medifund. And this applies to all patients, regardless of their vaccination status. I want to assure lower-income Singaporeans that financial assistance will always be available to them to help defray their hospital bills. Second, community isolation facilities, CIF. Not many people remember what they are anymore. We set these up in the early stages of the pandemic for COVID-19 patients who are generally well but cannot isolate at home for various reasons. With COVID-19 becoming an endemic disease, it should be treated like influenza, and there is actually no need for CIFs. The third change applies to individuals with acute respiratory infection who seek treatment at polyclinics and GP clinics. With the protocol 1, 2, 3 steps down, patients will now have to pay for any ART and PCR tests that are required for their treatment, subject to prevailing subsidies and consistent with how we treat other illnesses. On the other hand, we will continue our surveillance program because we will need to do PCR tests on a sample of people every week, and so that we can monitor the evolution of the virus. And for those tests, they will continue to be free of charge because they are part of our national surveillance program. Fourth, we will continue to offer free COVID-19 vaccinations and the use of oral antivirals in primary care settings, outpatient settings in hospitals, and nursing homes. These drugs can help to reduce the onset of more serious complications, thereby reducing admissions to hospitals and reduce the strain on our system and our healthcare workers. And this is also aligned to Healthier.sg, because when we roll out Healthier.sg in the second half of this year, we intend to offer nationally recommended vaccinations free of charge to all Singaporeans when they are eligible. The changes we announced today will be effective 13th February 2023, next Monday. But for the new financing arrangements, we will start 1st April 2023 to give more time for transition.